Imagine a 34-year-old woman 6 weeks into her pregnancy, filled with the joy of expecting. Suddenly, she notices light vaginal bleeding. Fear and anxiety grip her heart. This scenario is not uncommon. Early pregnancy bleeding, while alarming, is experienced by many expectant mothers. Today, we delve into a case study to understand this phenomenon better. We will explore the diagnostic tools and medical insights that guide the management of such situations. Let's meet Sarah, our case study for today. Sarah is a healthy woman, thrilled about her pregnancy. This is her first pregnancy and she has been meticulous about prenatal care. When she noticed the bleeding, she immediately contacted her doctor. This quick action is crucial in early pregnancy. It allows for timely intervention and helps alleviate potential complications. Sarah's case is a reminder that early pregnancy can be unpredictable. However, with prompt medical attention and a clear understanding of the issue, expectant mothers can navigate these challenges with greater confidence. In the following sections, we will explore Sarah's case in detail, shedding light on the various aspects of early pregnancy bleeding. When Sarah arrived at the clinic, her doctor first wanted to get a complete picture of her health. This began with a detailed medical history. This included inquiring about any pre-existing conditions, previous pregnancies, and family history of pregnancy complications. Sarah revealed she had no significant medical history and was leading a healthy lifestyle. Next came the physical examination. The doctor checked Sarah's vital signs, including her blood pressure and pulse. A gentle abdominal examination was performed to assess her uterus's size and tenderness. The doctor also performed a pelvic exam to visualize the cervix and check for any visible bleeding source. Throughout the examination, Sarah's comfort and concerns were prioritized. Following the examination, the doctor ordered some blood tests. These included a complete blood count to check for anemia and infection. Crucially, a β-hCG hormone test was ordered. This hormone is vital in pregnancy, and its levels can provide valuable information about the pregnancy's progression. The doctor also recommended an ultrasound scan, a powerful imaging technique to visualize the pregnancy and rule out any potential complications. The ultrasound scan is a crucial tool in early pregnancy. It provides a window into the womb, allowing doctors to visualize the developing embryo and surrounding structures. For Sarah, the ultrasound held the key to understanding the cause of her bleeding. The sonographer, a trained professional skilled in performing ultrasound scans, gently moved the transducer across Sarah's abdomen. The ultrasound images revealed a reassuring sight, a gestational sac nestled within Sarah's uterus, confirming an intrauterine pregnancy. The embryo was visible with a detectable heartbeat, bringing immense relief to Sarah. The sonographer also pointed out a critical finding, the double decidual sign. This sign, visible in early pregnancy ultrasounds, further confirmed the pregnancy's location within the uterus. However, the ultrasound also revealed a small collection of blood behind the placenta, known as a subchorionic hemorrhage or hematoma. This finding explained Sarah's bleeding. While the discovery of the hematoma caused some concern, the doctor reassured Sarah that it was relatively common, especially in early pregnancy. The size and location of the hematoma would be closely monitored in subsequent scans. Section 4. The double decidual sign, a reassuring beacon. The double decidual sign, prominently visible in Sarah's ultrasound, is a key indicator in early pregnancy. But what exactly is it, and why is it significant? Imagine the gestational sac as a tiny balloon nestled within the uterine lining. This lining, called the decidua, appears as a double layer surrounding the sac in early pregnancy ultrasounds, hence the term double decidual sign. The presence of this sign is reassuring for several reasons. Firstly, it confirms an intrauterine pregnancy, meaning the pregnancy is developing within the uterus where it should be. This distinction is crucial because pregnancies that occur outside the uterus, known as ectopic pregnancies, are serious and require immediate medical attention. Secondly, the double decidual sign helps determine the pregnancy's gestational age accurately. Its visibility is most prominent between 6 and 10 weeks of gestation. The clarity of this sign in Sarah's ultrasound, coupled with the embryo's size, helped confirm her gestational age as 6 weeks. This information is vital for monitoring the pregnancy's progress and planning future prenatal care. Section 5. The hormone of pregnancy, β-hCG levels. Remember the blood test for β-hCG that Sarah had done? This hormone, often called the pregnancy hormone, plays a pivotal role in confirming and monitoring pregnancy. β-hCG is produced by the developing placenta and is detectable in the blood and urine soon after implantation. In early pregnancy, β-hCG levels rise rapidly, doubling approximately every 48 hours. The doctor carefully analyzed Sarah's β-hCG levels, comparing them to the expected range for her gestational age. In a normal pregnancy, these levels correlate with the pregnancy's progression. If the levels are too low for a given gestational age, it could indicate problems like a miscarriage or ectopic pregnancy. Conversely, abnormally high levels could suggest a molar pregnancy or multiple gestations. In Sarah's case, her β-hCG levels were well within the normal range for 6 weeks gestation, providing further reassurance about her pregnancy's health. Monitoring β-hCG levels, especially in early pregnancy, is crucial. It helps detect potential complications early on and allows for timely intervention. Section 6. Subchorionic hemorrhage, understanding the risks. The ultrasound revealed a subchorionic hemorrhage or hematoma in Sarah's case, a finding that often causes anxiety among expectant mothers. But what exactly is it and what are its implications for the pregnancy? Imagine a small pool of blood forming between the chorion, the outer membrane surrounding the embryo, and the uterine wall. This collection of blood is what we call a subchorionic hemorrhage. The exact causes of subchorionic hemorrhage are not always clear. However, several factors might contribute to their development, including implantation bleeding, uterine abnormalities, infections, and maternal health conditions like hypertension and diabetes. It's important to note that in many cases, no specific cause can be identified. The good news is that most subchorionic hemorrhages resolve independently, without causing any harm to the pregnancy. However, larger hematomas or those located close to the cervix can pose risks. These risks include preterm labor, premature rupture of membranes, and in some cases, miscarriage. Therefore, close monitoring of the hematoma's size and location is crucial.